because the government's not going to force people to buy something they don't want to buy, they're not going to buy it. That's basically what they're saying. And I would also say the reason Tom, I think, is more accurate on this is CBO said that today we'd have, what, 26 million people in Obamacare? There's 11 million people. So CBO has been pretty far off on these Obamacare coverage estimates.
CBO was 26 million, included Medicaid. You're not counting Medicaid expansion in your 11 million.
Right.
So we're at 20 to 26, in fairness.
Good point. I appreciate that. Thank you. The point I'm trying to say is they've been pretty off on these government-mandated benefits. That's the thing. When government looks at estimating government mandates, they assume total compliance with government mandates, and it's not accounting for the fact of reality. This thing's collapsing, Chuck. I mean, it is in a death spiral. That's not just my words. Those are the words of health insurance executives.
And what I mean when I say that is... How do you say this is a death spiral if more people are still signing up? Yes, premiums went up, but you still have Obamacare subsidies in there that has shielded many of these people from some of these premium hikes. It is not the definition of a death spiral where it's, you know, suddenly you're having it where premiums are going up and nobody's buying it.
Let me tell you why. I'm quoting the CEO of Aetna, one of the biggest health insurance companies in America. And what is happening is young, healthy people are not buying Obamacare. They're paying the fine instead, and they're not cross-subsidizing older, sicker people. And that means the quality or the health of the pool is less healthy. So the rates are going up. The rates went up 25% on average this year. In Arizona, it went up 116%. And so insurers are saying we're getting out of this market. This market is collapsing. We're getting out of it. United pulled out. Aetna's pulling out in many markets. Humana pulled out. So we're seeing all these insurers pull out to the point where 5 states have only 1 insurer left. More than 1,000 counties in America have only 1 insurer left. With Humana's recent announcement that they're pulling out in 2018, there are now areas like in Tennessee where there are 0 insurers left. This law is not getting better, it's getting worse, and the premium increases that we're being told to expect next year if we do nothing will be even higher than this year. That means it spirals out of control. That is a death spiral. To correct you on that one, there are many analyses that say, look, this was the corrective year on premium increases, and now you're going to have a stable market going forward. We've had 3 years of this. That's not what we're hearing from the insurers. And why would Humana pull out if that's the case? Why would Humana say, we're out of here in 2018? Why would they do that? They may have their own budget reasons, and they may have their own merger reasons. They were the captive insurer. They were the sole insurer in an area. Nobody had a choice but their plan. They were basically a monopolist. If you're a monopolist, you probably don't want to give up your monopoly unless you really can't make money being a monopoly, and they're pulling out. So that tells you something.
Let me ask you this philosophically. Is health care a right or a privilege?
Not from the government. So if you say that healthcare is a government-granted right, then we as citizens are giving the government too much power over our lives. If we are saying we want this to be a government-granted right, then we as citizens are saying it is the government who gets to decide where, how, when, and under what circumstances we get health care. That's given the government far too much power over our lives.
Okay, but let me ask you this question.
No, I want to get you there. Don't cut me off.
All right.
I love you. We're buddies, but, you know, we're friends. Go ahead. But the point is, healthcare is a need, and we respect that need. And the question is, can we have a system in America where everybody can get affordable coverage? Can we have a system where everybody can get affordable coverage with more choices, even people with pre-existing conditions? The answer is yes. And it is not Obamacare. It is what we are trying to achieve here. The 3 things we're doing through this bill, through the things that Tom Price can do to deregulate, and all the other reforms, we fundamentally believe, and I'll stand by this 1,000%, that we will be able to offer a better system that has more access and lower coverage costs, including people with pre-existing conditions. Obamacare is not going to deliver that, and that's what we're trying to achieve here, because this is a very important need that everybody has.
The reason I ask